The topic I'm going to talk about today is a physician assisted suicide, a global ethical dilemma. The reason I chose this topic was because I just got graduated from respiratory therapist school. And in the hospital, I witnessed a lot of patients that were critically ill and terminally ill with diseases and things like that. They just didn't have the options that I thought they would have being terminally ill when it came to physician assisted suicide. So it really opened my eyes to what the patient's options are. Another topic I felt that was important was I didn't know that it wasn't legal and it wasn't, globally available for patients who were sick. So I kind of wanted to go into a little bit of a background of what is assisted suicide. It's basically just a term that is helping a patient to end their life, to go ahead and make that decision to have somebody give them some kind of medication or drug to basically go to sleep and end all their suffering or pain or anxieties or stresses that they do have. And how is it a global ethical dilemma? So, a lot of factors came into play. We have the Hippocratic Oath, which is taken and sworn by doctors. So it is you're kind of on the line, borderline of whether it's right or wrong. A lot of opinions and a lot of things go into that with, patients and, people's personal morals and values and backgrounds. So I just wanted to kind of stress out, how important it is and how it's going to affect everybody, because at one point in our lives, we might be in those situations where it will be our last, decision we ever can make. It does suck because there is a lot of obstacles that a person has to go through to have this decision. They cannot just decide, okay, well, I want to terminate my life. They have to be of 18 years old. They have to pass a screening test. So it does, play a big part in somebody's decision. And it, matters where they live. Sometimes it's not even legal in some certain states. And I was very surprised because California, being such a large state, it wasn't legalized in. It just recently passed, maybe this 2 years ago. So these are the states here, and I kind of showed that on a map that are legal now. And these are the states that are still fighting to try to make it legalized and, to give patients an option when it comes to physician assisted suicide. And a good point that I wanted to point out was in Serbia. In Serbia, it actually is illegal. And it is so bad and considered such a sin, not only for religious purposes, but, state wise and country wise, it is actually illegal like murder. So somebody that, any kind of physician that gets caught doing it is actually trialed as a murder, will go to jail, and some even get the death penalty. So this makes it very hard for patients that are in Serbia that are looking for an out for physician-assisted suicide. And here's kind of assisted suicide in Europe and how where it's most punishable, and that would be all in the red. So everything that you do see here is pretty much you're gonna get trialed as a murderer. If you are dying of a terminal illness or a disease and you want to end your life, basically all in red is going to be where you cannot in Europe participate in the assisted suicide. Now, with that being said, we come to the family influences and what and how it actually does make a big role in somebody's decision. A family's opinion is such a huge part of somebody's whole life. So for them to say, hey, I don't believe in that, there could be a chance that you could survive, that also puts such a heavy damper on a patient's decision to go ahead and pursue physician assisted suicide. So there is so many impacts of that, being that somebody might throw in, they can survive it, they should listen to the doctor and maybe go through chemo and go through longer suffering processes, which a lot of patients really don't want to go through. They want to go ahead and ease out of doing anything drastic or leaving burdens for their families. So they don't want to go through doing all the chemos and the treatments and things like that for certain cancers or diseases, because they know it's going to just consume their body, and they're basically dying a slow death. So family does basically take over their decision in doing physician assisted suicide. And it's crazy because I think physician suicide happening a long time ago, based on the Bible, thou shalt not kill. So somebody's perspective in physician assisted suicide can go back to religion. And religion is now another, issue that comes with physician assisted suicide because of the 10 Commandments. You have, thou shalt not kill. Then you have other places around the globe who countries they live in are religious fanatics. They do not partake in any kind of Americanized or any cultural changes to their country. So they do not allow any kind of physician assisted suicide thoughts, any kind of impacts of having doctors come into these countries and speak about different ways, that they can maybe do comfort care and things like that for patients that are suffering. And, if they do decide to go through with it and not follow state laws or religious backgrounds, they actually could be excommunicated, not only from the town they're from or city, they can be excommunicated from their religious background and even excommunicated from their country. So it is a big factor when it comes to that global decision. If it became, legalized, I feel that it's a person's right. It's our mind, it's our body. What we want to do with it, it should be our right. We shouldn't have anything dictating our decision, not governments, not countries we live in, not religious backgrounds. Our right is our right. It's our body. We should have that right. So I was really strong and had a really strong opinion about that. And that should be the conclusion. And here are my references. Thank you.